Celebration with Action meeting and event. As you know, the American Cancer Society Cancer Action Network, also known as ACS CAN, that's how we lovingly refer to it, is the advocacy affiliate of the American Cancer Society. We are here to celebrate the progress that ACS CAN has made over the last 10 years. But we are also here to let decision makers in Congress know that we want them to work harder. Thanks to the breakthroughs of research in cancer, many of which I could recount for you here today, millions of cancer survivors and their families have reached milestones in their lives that they may never have had the opportunity to be here because of the research has saved their lives. Whether their milestone is to celebrate another birthday, reach retirement age with their spouse, or simply to enjoy one more holiday meal, these moments are how all cancer survivors recount their story. ACS CAN has also reached a milestone. 10 years ago, ACS CAN was born, and we are now the largest, most powerful, most successful movement of volunteers that have moved mountains in our goal to save lives from the disease that takes so much from so many. Over the first 10 years, our organization has achieved many great successes. Let me name just a few. Together, we passed tobacco taxes that has prevented our youth from starting smoking. Together, we have successfully pushed Congress to double research funding since 2003. Together, we are working for a smoke-free nation, community by community and state by state. Together, after a dozen years of hard work, we finally have FDA regulation over tobacco products, which is already beginning to see an impact. And together, we have worked to ensure that cancer patients were at the front and center when legislation was being formed to reform our healthcare system. We are rallying together today with cancer survivors, their caregivers, and the ACS CAN grassroots movements of volunteers who are committed to making cancer a top national priority. We are here to celebrate, yes, but we are also here to take action. Hear me loud and clear. We want to urge Congress to double funding for cancer research over the next 8 years so we can double our hope to put an end to this disease. Let me introduce to you now one of those caregivers, a man who's dedicated his life to treating people with cancer. He is a radiation oncologist here at Pennington Cancer Center. Please join me in welcoming Dr. Will Russell.
Thank you, Sue. As Sue said, we have seen exciting things, and you will hear from some cancer survivors here who participated in some of this groundbreaking research. The American Cancer Society is almost 100 years old. When it started in New York City in 1913, cancer was a stigmatized disease that doctors didn't even tell their patients they had the diagnosis. We had no way to treat it. We've come a long way since then. Everybody knows the wonderful things that the American Cancer Society does for patients in terms of support, education, and funding researchers directly from funds donated to the American Cancer Society. Well, 10 years ago, another part of the organization was formed and has had great successes. That is the Cancer Action Network. If you will, it's a PAC, because in today's world, funding is a political creature. And without funding, these trials that have yielded so much wonderful fruit won't be carried out at the speed that they need to be. We have incredible research being done in this country in terms of understanding the causes of cancer and how to treat people, particularly in the area of genetic understanding of cancer and understanding not only who is at risk, but for those who are diagnosed, what the best way to customize their treatment is. We really need to encourage our congressmen, such as my friend Dan, to continue the fight to help fund cancer research. Dan can't do it without us backing him up. When he's standing there by himself, he doesn't have nearly the voice that he has if he's standing there with all of us behind him saying, you go, Dan, you go. So it's very important. We need to continue to push for doubling the funding of the NIH and the NCI. We have over 569,000 people who die from cancer every year in this country. We can do better than this. We need to continue to fund the researchers that are finding us the answers that I need to help me take care of people. There isn't anyone here who hasn't been touched by cancer, either in their direct family or close friends, if not themselves. This research is vital. If you ask those people, they would tell you that that is much more of a priority than some of the things we're hearing about. We need to support the Cancer Action Network. We need to continue to push for $35 billion in funding for the NIH and $601 million for the cancer control programs at the CDC. Congress has authorized this. We need to make sure that this money is pushed through and actually funded. So I'm just glad to see this kind of event calling attention to a wonderful organization and a wonderful piece of the organization. And happy 10th birthday to the Cancer Action Network.
Thanks, Dr. Russell. He has recounted our history of the ACS CAN. Our power continues to be our stories. There are people everywhere within the sound of my voice that have been touched by cancer. Survivors, caregivers, family members are sharing their experiences with cancer with elected officials all over this country. I'd like to introduce you now to one such survivor, a breast cancer survivor who's had many birthdays because of the treatment that she received, Cindy Jones.
I would like to first start by showing you this photograph. This is my family. My parents are here today. This is only 23 people in my immediate family. 4 have had breast cancer. So I know a bit about breast cancer and treatment. My mother is a 20-year cancer survivor. My niece's mother-in-law is an 8-year survivor. I'm a 3-year survivor. And my friend Julie has had surgery this morning for breast cancer. The biggest difference is the treatment, and I was lucky enough to have Dr. Russell and Dr. Militella ask me to be in a trial. And it was an oncotype test trial that tested the tumor because my biggest fear was the fear of having chemotherapy. I knew I could get through the surgery, I knew I could get through the radiation, but I had seen the effects of radiation on people I knew and loved. So when I was able to get into that trial, they were able to take the tumor and test the tumor and come back, and this is how I let my friends know. I got results. No chemo. And that is my story. I was able to avoid chemo and the effects of chemo and the cost of chemo. And because of my trial that I was in, my friend Julie is now able to take this test and possibly avoid having to take chemo too. So that's a blessing, and that's something I'm very proud to be a part of. And this man and Dr. Militella, you may not see it, but they do have angel wings. They are angels to me. My mother has been a survivor, and it just makes me very proud to be here with all of you this morning. And that's my story, and I'm sticking to it.
While we are going to be in action at a federal level, we've also done a lot of work at the state level. And so I'd like to introduce to you one of our senators who's worked with us to help have good public policy at a state level. Because hear me, you can't just do this at a federal level. You have to do it at a state level and a local level. So joining us today is Senator Dan Clare.
Thank you, Sue. It's my pleasure to be here. I want to tell you, when I'm at the legislature, I see Andrew and Sue and a lot of other people coming down there working in the trenches day in and day out. and you know they got to be dedicated if they'll come down there and spend their time with us. I'd like to thank the Baton Rouge High Magnet Band for being here today and helping out. As we heard earlier, cancer certainly affects everybody. We all have a story that we can tell as far as how it's affected our family members. My father-in-law was dead and gone before I ever met my wife as a victim of colon cancer. My grandmother, leukemia, and we all have stories like that. And the times have changed quite a bit in that we're making lots of great progress. When you look at the numbers, we're certainly headed in the right direction through the efforts of people like Pennington's and the Baton Rouge General, Dr. Russell. These stories that we hear of the survivors and the things that they've done inspire us each every day to get up and face the day with the little minor things that we have facing us. And so to each of the survivors, you're an inspiration to me every day to get out of bed and do the things that I need to try to help move this movement forward. Yet, there's a lot of work left to be done, and we can't do it for free and with good intentions. It takes money to get these things done. And my short time in politics, I've certainly understood that money is what moves us forward. And so I'm here with you today to encourage Congress to continue to fund and increase their funding on cancer research. And I'm also here to say thank you to Baton Rouge General, thank you to folks like Dr. Russell, and thank you to the Penningtons, and congratulations for this great celebration at 10 years. Thank you.
Today. There are stories like these all across our country, in every town, in every state, every community, in your neighborhood. Every cancer survivor has been impacted by research findings, and it's up to us to fight back. Cancer research funded by the federal government is the largest single pool of dollars that researchers have to fight this disease. It is up to us, the voices of America, to tell the stories so that Congress will understand how important we feel that cancer research really is. Starting here and starting right now, we are going to collect 100,000 milestones from across this country, and we're bringing it to Congress next week. We want you, people who are here, members of the band who may have family members, orchestra, who may have family members who have been affected by cancer, we want you to write your story in this book. You see, it's really hard. I can go up there and talk about data, so can Dr. Russell, but it's really the stories that get to members of Congress. And so there are several of these books, and we want you to sign. Just tell us your story so that we can share it with Congress. Also, if you want to become a member of CAN, that's really easy. There are applications right over there at that table. We also have over here, we're writing in chalk a story about what you know about cancer. My story's over there. I have 2 employees, both of whom were diagnosed with leukemia, both of whom had bone marrow transplants, and both of whom are alive. That's incredible. There's a banner if you can sign that. We want to take this to Washington and show Congress that while I may be there, there are hundreds and thousands of people behind me. So I hope you'll join us. I want to thank the orchestra, your leader, your parents. Thank you so much for being here. I really appreciate your talent. Love that.